And so thank you again to everybody who has participated. We are coming to the last part of the conference today, which is going to be a recording of the Not Many Adults podcast. For those of you that haven't listened, the podcast was started by my wife and I during the pandemic. As we couldn't raise money, we wanted to still continue learning and talking about the charity that we have, which is called Thinking of Oscar. And we created the podcast for three reasons. One was to educate ourselves so that when hospitals and pediatric units talked to us and said, would you be interested in funding such and such a technology, or do you know anybody in this field? Then we have better understanding as to what that might look like. We also wanted to educate and share the stories of the innovators out there who are trying to do something within children's health, trying to make a difference, looking to create new solutions or doing things that haven't ordinarily been done. We wanted to share those stories. And we also wanted to inspire. We were hoping that we could inspire the next generation of pediatricians or the next generation of innovators within children's health to come forward and think about how they might be able to make a difference. And in turn, we created the Not Many Adults podcast. We're on our fourth season now, and you can listen to past episodes wherever you get your podcasts, Apple Podcasts, Spotify, Amazon, wherever it might be. So without further ado, I am delighted to welcome Leanne West to this session. We are waiting for a couple of others. We have Pilar as well. Fantastic. And I think we are just waiting for one. Anyway, without further ado, thank you, ladies, for joining us. Hopefully, Dr. Berman will join us very shortly. But it's great to see you both, and thank you for joining us on the Not Many Adults podcast.
Thank you for having us.
Thank you very much, David. Yeah.
Wonderful. So, Leanne, maybe we'll start with you. If you could just give us a brief introduction as to who you are, what you do. This podcast is all about how do we bring sustainable, impactful innovation into children's health. And I know that that is exactly what you're doing in the world in which you work.
Yes. So I kind of have two jobs. One of which I am the Chief Engineer of Pediatric Technology at Georgia Tech. And in that role, I talk to clinicians and understand their needs and try to put the solutions together that I think can solve the problems that they're having, taking the best care of their kids. The other thing that I do is I am the president of the International Children's Advisory Network. And that is a nonprofit where we make sure that the child is involved in every step of research and clinical trials and development of devices or drugs, whatever it may be. We want to make sure that those who are the experts living with these conditions have a say in how things happen.
Fantastic. Thank you. And Pilar, welcome. Thank you for joining us as well. Maybe you could give us a brief overview as to your role and where you are as well.
Yeah, sure. So my background is in molecular biology, doing a PhD, and it's really just a year ago where I joined our Barcelona Children's Hospital, a worldwide reference as a children's hospital, as an entrepreneur in residence, and there I have the opportunity to see problems firsthand, I would say, and to be involved in the development of solutions, also hand by hand with the children. So I'm more like the entrepreneur profile here.
Fantastic. And it's great to have representatives obviously from the US and from Europe. We are hoping that Dr. Jason Berman will join us from Canada as well. And he leads up the Research and Innovation Unit for the Children's Hospital of Eastern Ontario. So we hope that he will join us in due course. Leanne, as we said, we want to talk about how do we bring sustainability to pediatric innovation. And I know that you kind of bridge the gap between Georgia Tech and Atlanta Children's Hospital. Talk about the journey that you guys have gone on in order to get your innovation unit to where it is today.
Yes, it's really been exciting. Um, when Children's Healthcare of Atlanta decided they wanted to get more into research and innovation in pediatric healthcare, they decided to partner with Georgia Tech as opposed to bringing resources to their buildings and their hospitals. So why reinvent something if you have Georgia Tech just right down the road? Um, and so that's really how we started. And we started by funding lots of projects. Truly, what I did in the very beginning was met with doctors and nurses and shadowed them and just said, if you could fix anything, what would it be? And we took those recommendations to heart. And those are the types of problems that we work on. So everything is clinician driven, which I think is very important. You want things to be solving real world problems. And then in addition to that, we also make sure that you have the clinician and the engineer fully engaged in the project and the development cycle, because you need to make sure that whatever you're developing fits into their workflow and work process. So those are some of the things that we do to ensure that we're doing things correctly. We will also include other parts of the hospital, like IT, for example, if we're building an app or some piece of software that we want to work with. So we really try to bring in all of the right people from the beginning.
Fantastic, thank you. And I'm going to come back because I've got more questions around that in a minute. I'm just going to see if we've got, Dr. Berman, Jason Berman, thank you very much for joining us. Can you hear us?
I can. Can you hear me?
Wonderful. Yes, we can. Fantastic. There we go. The joys of doing a live podcast as opposed to one that's pre-recorded. So thank you so much for joining us. Please, could you just maybe give us a quick introduction as to who you are and where you are, please?
Yeah, sure. So, and again, apologies for connectivity issues. I was trying multiple devices, multiple different ways. And, this is all about innovation and technology, right? So you got to find innovative ways to connect. So I'm Jason Berman. I'm the CEO and scientific director at the Children's Hospital of Eastern Ontario Research Institute and the VP Research at the Children's Hospital. We call it CHIO for short, Children's Hospital of Eastern Ontario, and we're in Ottawa, Canada. So our hospital and our research institute serve the eastern portion of this province, as well as Western Quebec. So it's a catchment area of about 2.5 million people. I'm a pediatric hematologist oncologist by training, clinician scientist, and really delighted to be here.
Wonderful, thank you. I'll let you catch your breath, take another sip of your tea whilst I talk to Pilar, if that's okay, and then I'll come back to you. Pilar, again, thank you for joining us. So Barcelona Children's Hospital to me is one that always gets mentioned as a very innovative unit across Europe. I know that there's been lots of things going on in the last week or so in terms of hosting accelerators and these kind of things. Talk to us a little bit about what you're doing in Barcelona. Now we can't hear you. Hang on 1 second.
No, my fault.
Now we can
Sorry,
hear you.
It was me.
Okay, no problem.
It was me, sorry. The innovation department was born in 2008, and just the economical worldwide crisis started. So thanks to this crisis, budgets were cut, salaries were cut, less staff working at the hospitals, more constraints. But this was what motivated the innovation team to make a big team through the professionals, through the health professionals that started to get involved with the innovations since day one. So this is what Liana was saying, that they do this all together. So we had to do it this way. It was like the only option because of the economical constraints. But at the end, we realized that this is the way to do it, with the health professionals and then with the families and the children. So from the hospital, we have also built an innovation hub, the i4Kids Pediatric Innovation Hub, that is now also with a European vision that is trying to help all the projects and startups, help them in terms of technical aspects, but also in terms of funding, acceleration. So the aim of the hospital is that we build together, at least through Europe, a solid ecosystem that really helps us bring the innovations to the market.
Fantastic, thank you. And in the excitement of getting everyone on the call, one thing I forgot to mention to those listening was, please, if you have any questions for the panel, put them in the chat. We will make sure that we've got some time at the end of the session to pose those to everybody. Jason, coming back to you, I know that your innovation hub is relatively new, whereas some of the others have been going for a while. Talk us a little bit about the journey that you've been on in order to get to where you are today and how that came about.
Well, thanks very much, David. And again, thanks for having me here. And it's actually somewhat momentous that we have this panel today, because earlier this morning, we held an event announcing a large federal government grant to support innovation at CHIO. And so, the timing is really ideal. And, 4 years ago or so, when I came to CHIO, we didn't have an innovation program here. And this program really arose as a grassroots effort from one of our surgeon scientist entrepreneurs who had already developed some technologies, and a number of years ago, when he had worked elsewhere, had developed technology and then went to leadership of the hospital and said, how do I roll this out? How do I get this to patients? How do I market this? And they said, that's great, but we don't do that here. And so that really resonated with me. We wanted to create an environment where we do that here, where people of that kind of mindset don't have to leave children's hospitals, don't have to leave the academic environment to be able to bring their innovations to life. And that really we started first really with an innovation task force, where we sort of brought people together, clinicians, researchers, scientists who were interested in innovation, interested in technology. Over time, that then morphed into a formal core of our research institute, and we've labeled that TECHI, Technology Enabling Children's Healthcare Innovation, and has really brought together a core group of individuals and professionals with expertise that we've continued to build, and we've created partnerships. We think of innovation as both being inside out and outside in. So inside out is where, with the example I gave of one of our surgeons, the technology is derived by one of our clinicians, one of our researchers, and they then want help to bridge that gap to industry, to commercialization. And so the idea of this techie core is to help them do that. But by the same token, it's also for outside in innovation. These are companies that have developed technologies but aren't sure how best to adapt them. They want to work with our clinicians. They want to work with our researchers, with their expertise, with our patient populations. And then they reach out to us for us to be able to connect them with the clinical experts.
I think for anyone that's looking to set up a innovation unit, the interesting thing is that we've seen it from yourself with your kind of clinical lead wanting to take innovation forward and create something. So I'm going to give a shout out to my colleagues at Alder Children's Hospital and Ian Hennessy, who most of you will know, who also set up the innovation unit at Alder. And of course, our own Paul Dimitri, who's looking to do the same with the with the National Centre for Child Health Technology here in Sheffield. And one of the elements that I've seen through my own research is that importance of having the clinical foundations, the clinical agreement, getting clinicians on board when you're trying to bring any innovation into the fore, as well as obviously parents and children, which we'll come to in a minute. But Leanne, I know that you work very closely with your clinicians. Talk to us a little bit about how that works and why they bring such an important facet to your innovation model.
Oh, absolutely. So, really, like I said, when I started out, I just would go and talk to clinicians and understand what their needs are. Now, a lot of times people come to me, they know that I'm the connector. And so they'll tell me about an idea that they have or a need that they have. And what I do is try to figure out, okay, then you're going to need to work with this kind of person or this kind of engineer to build a solution that's going to meet your needs. And so I'll put those teams together and let the teams go off and work. So really, I'm that facilitator between the clinician and the engineer to make things happen. Another exciting thing is that we don't just work with Children's Healthcare of Atlanta. That's how we started. But we also work with other children's hospitals around the world. And so it's been very exciting to bring new children's hospitals on board to work with us and to come up with those solutions. And I think the other thing that's really interesting is, excuse me, is how often the needs are really the same across the children's hospitals, right? They all kind of encounter some of the exact same problems. And I think that with funding in pediatrics being so small, it's something that I would love to see children's hospitals work together on more often, is that innovation and what it looks like for them.
I couldn't agree more. And so coming straight to the kind of crux of what we want to get to in this conversation, and Jason, we'll come to you in a minute, because just a reminder, we want to talk about impact and we want to talk about sustainability. It sounds like, Jason, you've got an opportunity of sustainability with some federal funding. Pilar, coming to you, talk to us a little bit about how you see impactful innovation happening within Barcelona or in the wider European ecosystem.
So first, the main problem is defining what impact is, and that we all agree with the definition of impact, and that we all create metrics, KPIs for this impact. My hospital is still working on this, and it's something that is evolving. Like typical metrics would be lives that have been saved, or less days at the hospital, but we also have to include quality of life, or years of lost life, or years of disability. And this is something that we don't only have to put it in a piece of paper, but really also educate all the stakeholders in these terms. So the health professionals not only need to think of the need they have and then the solution, but think a bit more further and try to focus also on these important impact factors. So I have to say that it's work in progress.
And I think you are not you're not on your own from that point of view. From my own research, which I think I shared with each of you, impact was something that was not particularly well defined, as you've just said, and it was qualitative at most and very seldom qualitative. Jason, what does impact mean for you guys, given where you are, given what you're trying to do, given potentially some of the funding that you've just received?
So, I think the impact metrics that Pilar was talking about are important. We need to be able to quantify that impact. But I think also it's, when I came on, I heard Leanne talking about this, it's identifying what the right problems are. And it's the clinicians that are at the rock face, it's the patients and the families, they can identify the problems. We could have a technology over here that is great, but if it isn't applied, if it's not addressing what the problem at hand is right now, then it's not going to have the kind of impact that we need. So it's really understanding those patient populations. What's the problem that we're trying to solve, and it's asking that in an iterative way as things evolve, because those needs may change over time. I think more broadly, it's really doing things differently. And this was some of the conversations I had with some of the politicians that were visiting here this morning, is that, if you think about everything else in our lives, we do things differently than we did 10 years ago. We cook differently, we drive differently, we travel differently, we communicate differently because of bits and pieces of technology. And so we need to think about that the same way in healthcare, right? Just like you wouldn't necessarily want to travel the same way you did 10 years ago. You want to have the technologies, the comforts, that enable that. Same thing. You want your healthcare to be contemporary. We want to have the technology, but it's not only in healthcare. It's not only the way we may think in travel. Well, maybe that's sort of a luxury or a nice to have. In healthcare, it's a need to have, because we've seen through the pandemic, the healthcare, through that healthcare crisis, the challenges we have. And those are realized even more so in children's health. We talk about right-sizing children's health. There hasn't been the investment, and I don't think this is specific to my region, I think this is internationally, in children's health the way there have been in other parts of the healthcare sector. And the people that are most likely to invest in children's health are those people working in children's hospitals. That's what these people are doing. These are the professionals. This is their sort of raison d'etre. And so these partnerships with industry, these creating these incubation spaces, these working relationships, I think really helps foster bringing together people who understand children's health and those problems with companies and individuals that can find some of those solutions, partner them together, and that's where we're going to see the maximum impact.
I'm debating which question to ask next, because you covered one of the things I was going to say. Do we need to do things differently in children's health? Is one question. Leanne, I'm going to ask you this in a second. But the thing that's at the back of, or the front of my mind, should I say, is the problem is if we keep it within the confines of a children's hospital, we're all preaching to the converted, and we're never going to get growth and kind of wider impact and a lot more collaboration, shall we say, with that. Leanne, what do you think? How do we take it outside of the confines? And Jason, I don't disagree with you, of course, but I think we need to take it wider than that.
Yes. So the question is, how do we do something bigger than just working within the hospital?
Yeah.
I think that's happens when you present on technologies at conferences so you can share that expertise with other people who are experiencing the same problems. One of the things that we like to do at Georgia Tech with the focus on pediatrics is to say, let's solve it for the kids, but then how does that apply to adults, as opposed to the other way around, which is how things typically happen now. And as we all know, kids are not many adults. So I think that it's sharing that knowledge, it's understanding how the child is different, and then how can you take it beyond the child to adults as well.
And I didn't pay you to plug that, but yeah, sorry, Sheila, go.
No, the word that was coming to my mind was like educating. It's awareness to all to the public, not only to the health professionals or health stakeholders, but to everybody, because people with money, I think, can understand the needs in pediatrics if we tell them, if they get the message. And I believe that, I believe and I hope that in 10 years, there will be many more pediatric funds. And we will be surprised that in the past, there was none, like maybe 5 years ago. So I think that education and your podcast, for instance, or the I4Kids initiative that I was talking about, or the marketing activities that a hospital does externally, all this helps.
Absolutely. And yep, Jason, go for it.
I just wanted to build on Leanne's comment, because she couldn't be sort of more right about it's not restricting it in the children's hospital, but it's originating it there to make sure that kids get the benefit, and then moving that pipeline outwards to adults rather than the traditional way it's come in. And I have a perfect example. We have a surgeon, scientist, entrepreneur who created a hearing test. So he's a pediatric ENT who created a hearing test that's now been adopted by one of our large adult geriatric rehab centers, and now that company employs 150 people. So technology was developed in a children's hospital, but actually first adopted at the other end of the age spectrum, and that's a whole other conversation about all the similarities at both sort of ends of the age spectrum and how we can learn from each other. And in fact, the federal funding that we received today, the title of our initiative is 8 to 80. From sort of 8 minutes of life to 80 years of age. So really covering the breadth of that spectrum. And one could argue if we provide innovations for our youngest and oldest folks, that'll also help support everyone in between.
Well, Jason, I'd like to come back to you on that actually. So a kind of picking up on what you've all been saying, but one of the findings that I've also found is that we don't promote peds enough. We don't talk about children's health enough outside of our, immediate circles. And, probably in terms of measuring impact, we need to see where we are during this conference today and where we are in a year's time. And hopefully we've got more people from outside of the Children's Health Network, coming in as a result of what we're doing. But Jason, you must have used marketing, promotion, lobbying, whatever you want to call it, in order to get government funding. Tell us how you went about that and what that means for you.
So, I think there's a few pieces of that. I mean, one is showing some tangible results. So even at this morning's conference, we had one of the companies, we've been incubating a company at CHIO called Polyunity, which does 3D printing. And so in working together with them over the last 18 months, I think they've 3D printed, 1,500 different items from, test tube racks to, components for stretchers to deal with, supply chain issues where we can print things in-house and not take these pieces of equipment out of circulation while waiting and spending, a much higher cost to get them from, wherever they're being made and shipped. So using that as an example, a very tangible example, and we had them set up in a display for all the, for all the politicians to be able to do a little bit of a show and tell, I think was very, really helpful for people to see. Again, you talked about impact, but for people to be able to see, in a very tangible, tactile way, the kinds of things that can happen when partnerships go together. I think it's also identifying the problem. Someone said to me today when I talked about creating these partnerships, they're like, oh, doesn't this happen already? And I was like, no, this doesn't happen already. You have to actually intentionally bring these groups together. They've normally been very, very siloed, geographically siloed. You have your businesses at, whatever the business park out at, by the airport, and then the academics are in their universities and hospitals downtown, and never the two shall meet. So, it's bringing people together to in these really innovative teams to support each other. So I think it's to review in terms of responding to your question, it's showing some tangible results that people can get their heads around, and really identifying that there's a problem that actually needs that support. I think everyone is well aware through the pandemic that healthcare is not okay, that there is a problem. Like, I don't think we need to convince people that there's a problem in healthcare. I think people recognize that. And again, I think that's universal. I mean, we have different health systems in the different countries that we're representing here today, but regardless of whether it's a public paid system, a single payer system, two-tiered system, different systems, it's not running the way it should be. And so we really need these innovative solutions. And I think this is part of the way to get us there.
And forgive me, just briefly, what is your government hoping to see in return for the money that they have invested?
So, and the amount they've invested, to us, it's a substantive amount of money, but it's actually a pretty small amount of money. It's only over the first few years, and so we really see this as seed funding. It's almost like a pilot. Like, let's see what you can do with it, and if we're able to deliver on it, of course, we're going to go back for more. And then the other thing we hope to be able to do is be able to bring in from our, very supportive donor community, how do we leverage, federal funding and private funding and create those sort of partnerships to build something bigger. But, I think they are looking to see some substantive changes where we can point to key things that have been identified, such as access, surgical wait times, length of time people are staying in the emergency department before they're admitted, time to their admission bed. Those are things that I think all hospital administrators, keeps them up at night. How do we try to advance those things? And so if we're able to move the bar on some of those things, that would be helpful. And using technology like AI to be able to maybe better predict, what the wait times are going to be in emergency departments, or where patients should go, maybe that, based on sort of their, assessing the urgency of their need, what the right time and what the right location is for them to get their care. Those things may help create sort of these prioritizations that will improve things like access and flow.
So it's great to hear. I'm coming back to sustainability, and Pilar, I want to ask you, so commercialization, revenue, selling stuff, it tends to be a bad, kind of a bit of a dirty word in pediatrics. But earlier this year, I was at a conference and someone, put it in the way of saying, but without that, we don't get growth, we don't get scale, we don't get more children being impacted by the innovations that we've got. What's your feelings on that? And as an entrepreneur in residence, how do you advise the innovations that you're seeing coming through Barcelona to get to that point where they can actually, make revenue and therefore continue to be sustainable?
Barcelona Children's Hospital, Sant Joan de Déu, it's both public and private hospital. And as a private hospital, it's like in our DNA to get revenue from private patients, from like local and international patients. So I don't see it as a problem to think of revenue and making money. Also because, yes, I am an entrepreneur and I've been involved with business not all my life, but for a few years already. So for me, it's necessary. It's super important to link money with innovation with patients. They go together. Without money and without creating unicorns in pediatrics, we won't be able to impact the patients. And that's the ultimate goal. If we charge money or if we make money, it's okay, it's fine. As long as we achieve the goal to reach the market, I don't see it as a problem. The problem in terms of funding, at least here in Spain, is regarding donations. Usually the donations that we receive are more for doing research, not for innovation. So families that have been that had a child affected of a condition that were happy with the hospital, they will donate lots of money to buy this specific machine or to do research in this specific condition. And sometimes we would need more flexibility and be able to decide how we should spend this money and put much more money in the innovation part, starting from trying to commercialize the products rather than research. Yeah.
Jason.
Yeah, I just want to pick up on a point that Pilar made around funding for research. So, I think you're very right, and people, fund things that resonate with them because of the care their child or their family members receive, and they want to continue to support, cardiac research, cancer research, whatever it might be. But I think, getting fundraising for research can also be challenging because the timelines are very long, right? To see the impact from, especially if you're talking more, basic discovery research, something that's happening in a lab to discover a biomarker or a diagnostic test or a treatment could be many years in the making. And that's great. Of course, we need to support that work. I do that work myself. But one of the things around innovation, I think it's also the narrative to get people to support that, is people can see those results much more rapidly. The example I gave with 3D printing, you 3D print it, 20 minutes later, you have something you can show someone. And, people, human nature is we want quick results, right? We all want, we want to do a search on our phones and get the answer in 3 seconds. And so people are used to having that sort of quick response times, and so the ability to see that innovation, I think, makes it it's exciting, it's tangible. I think there is some fear there, And I was at a donor event earlier this week, and we were talking about artificial intelligence. And, I wish AI had a different title, because even just calling it artificial, freaks people out, right? Like, what does that mean? We don't want something artificial, right? Artificial's bad, natural is good. If really we called it what it is, and the way we're using it, and I think many of you are using it in children's healthcare around sort of predictive analytics, that is a much sort of, which really describes what it is. And you tell people, we're going to use this to try to predict which kids with asthma are going to return to the emergency department so that we can prioritize care, because our emergency department's so full then people say, wow, sign me up. I want to contribute to that because my kid has asthma or my kid had asthma when they were younger. We want to be able to address that. So I think part of it is also sort of the narrative and how we spin the idea of innovation, technology, AI, machine learning into things that people recognize are actually really friendly and not foreign.
Thank you. And just so we've got a little over 5 minutes left, I would think. And just a reminder for those listening, if you've got any questions, please put them on the chat, and we'll ask them to the panel. But I've got a good one for you, Leanne, if I may. A question coming in from the chat says, as innovators in child health, we have an ethical responsibility to ensure our innovations benefit children whilst avoiding potential harm as much as possible. What proactive steps can we take during the innovation process to identify, assess, and mitigate any potential risks or negative consequences? I feel like you deal with this every day.
I do. I feel like, yes. So I think getting that multidisciplinary team involved from the very beginning makes a difference, because I think that you have to take all of these different opinions and thoughts and requirements into consideration. And I think that's best done when you have a full group of interdisciplinary people weighing in on things. I think that involving the patient, involving the parents, how they're going to use a device or how they're going to use a system is really important. That way you can build something that can be used in the home if that's where it's supposed to go. And make sure that it works for them, right? So I think that there's just a lot of testing that you can do to bring in all of those opinions about the development process and the innovation process and the device that you're looking at, and really try to make sure that, we talked with the nurses and this is how they use it on the floor and it fits into their workflow and it doesn't block view of a port or whatever it might be. I just think that making sure that you take the big picture into account with everything you're building and not just the one doctor or the one engineer is really what can make a difference to make sure that you build something that is going to work in the real world and have less risk.
Pilar, have you got any thoughts on that as well?
Well, just this morning, I talked to a company from Italy that they are developing a diagnostic tool for autism. And I was asking them, for their pipeline, next products that they wanted to launch to diagnose other diseases. And they said that they would pick diseases that affect adults rather than children. And I asked why. And one of the answers was because of the paperwork, because all the ethical considerations that you have to look at, you have to talk to the families. It takes longer, more difficult, so we pick the adults. So I agree. I fully agree that we have to protect the families and children from the risks, but also make life easy for the entrepreneurs.
Absolutely. And Jason?
Yeah, I just wanted to pick up on Pilar's comment there, because I think that's very true. I mean, we see that I'm involved with pharma trials, and, people, really shy away from kids for the ethical reasons, also because it's a much smaller market, right? In terms of, we're often dealing with small patient numbers, rare diseases. But I think it's important that we, as children's people that are invested in children's healthcare or invested in healthcare in general, that we remind people like those healthier starts in kids are actually going to improve their health trajectory through adulthood and actually have less burden on the system, right? So this, the example Pilar gave, right, diagnostic test in autism, those kids are diagnosed earlier, get their interventions earlier, they're going to be much more able to adapt and function when they're adults. And so that's going to be less of a cost on the adult system many years in the future. And many adult healthcare providers and leaders and administrators, don't think about that because they're focused on their adult population. But if we're able to give a healthier start or optimize that start, the whole healthcare system actually will benefit, throughout its lifespan.
As you don't have a mic, Jason, I can't get you to drop it, but you could maybe just drop your headset, because I think that's it. That's the key message I think that we want to put across there. Unfortunately, we are running out of time. I've got a lot of other questions that I want to ask you guys. We'll have to do it offline. However, as is tradition on the Not Many Adults podcast, and Leanne, I'll come to you last because you know this question and you've done it previously. But for all of you guys, if you had a magic wand and you could change one thing within children's health, what would it be? And Pilar, sorry to come to you first, but if Jason's got an answer, he can go. But what would you change?
Multiple ones? Can I have many more?
Well, you have a magic wand. You can do as you wish.
Yeah, I would ask for multiple VCs investing in pediatrics, having many like competitors among them that they all want to fund innovation in pediatrics.
Jason?
So thinking about this as Pilar was giving her answer, and I think it sort of links back to the last comment I made, maybe that you have a crystal ball, and so that if you were able to show people what this investment early could translate into in terms of healthier adolescents, healthier adults, I think we would have a much greater investment and an easier time convincing companies, donors, entrepreneurs to invest in children's health. So having that crystal ball to be able to share that with people so they could see the return on investment.
That to me, I couldn't agree more. Again, I was having a conversation with a health economist this morning going over exactly those points. Can we get some statistics that talk about the social, economic opportunity that we have for keeping children well into adulthood? So we should, as we said, collaborate as much as possible on that and share in order that we can get the as many VCs as possible and as many organizations as possible thinking about and investing in children's health. Leanne, final word from you.
Yes. So I think that, innovation in pediatric healthcare isn't due to a lack of ideas. I think there are a lot of ideas out there and a lot of really good solutions that could make healthcare better, but I do believe that it is a lack of funding to be able to take something maybe past the idea stage or the prototype stage all the way to commercialization, because there's a big chunk of the puzzle in there that really needs to be covered. And then the other thing I'll add, just from my ICANN perspective, is I would love it to be standard practice that all clinicians and researchers and industry know that they really need to be focused on the pediatric patient. That's why we're all here. And so don't discount them, bring them into the loop. And if we could fix that in the future, I think that would be great.
Another mic drop moment. So thank you, all three of you. Thank you so much for joining us. Jason, Leanne, Pilar, thank you so much for joining us, not only on the Not Many Adults podcast, but on the Children's Health Technology Conference 2023. I hope to catch up with you all very soon, and I really appreciate you giving up your time to join us. Thank you so much.
Thank you.
Thank you for having me.
Bye. Thank you, David.